Amid the slowdown of infections in the nation, authorities are said to be leaning towards lifting the country's outdoor mask mandate, something that goes against what the Presidential Transition Committee's initial stance was. A final decision will be made on Friday. Shin Ye-eun brings the updates.
South Korea is continuing to see an overall drop in daily COVID-19 infections. On Thursday, the country logged 57,464 new infections, down by more than 19,000 from the day before. To shift the pandemic to an endemic, authorities have asked for active booster shot participation from older adults. Authorities have cited studies from Israel that found people aged 60 and up who've received a second booster shot had a 78% lower death rate compared to those who had gotten just one. So far, only 10% of people in this age group in Korea have received a second booster shot. In light of the drop in infections, authorities have also been discussing whether to lift the outdoor mask mandate. The Central Disaster and Safety Countermeasure Headquarters is set to announce its final decision on Friday, which would mark 2 weeks since the country eased most of its distancing measures. Yonhap News Agency reported on Thursday that authorities are leaning towards lifting this mandate starting next Monday. This is mainly because the country has already downgraded COVID-19 as a level 2 infectious disease from the highest level 1. But lifting mask mandates in early May goes against the plans of the Presidential Transition Committee. While unveiling a 100-day roadmap on how the new Yoon administration will tackle COVID-19, the committee's chairman An Chol-soo said they would only start considering lifting outdoor mask mandates from late May. Meanwhile, travelers to South Korea will still have to submit a negative PCR test result taken within 48 hours. While many have been asking for a reversal of this measure due to a small number of imported cases, health authorities said they would like to remain vigilant and stop any new variants from coming in. But authorities are considering whether to allow rapid antigen tests instead. Shin Ye-eun, Arirang News.